So tell us a little more about your role at Rochester Health and, what the digital landscape is there and what is your, experience with generative AI and what are some of the initiatives that are happening at your current organization?
Oh, absolutely. So I mentioned we're a 9 hospital system. We are mostly on one EMR system. We are an Epic shop, single instance. And when I say mostly, we over the years have grown through acquisition and have a number of practices that are on smaller EMRs, but we are, slowly but surely
Right.
moving them all into a single instance of EMR. In terms of our initiatives, I put them in a couple of different categories. The first is really trying to optimize the system and engine of delivery for care that we already have. And that means ensuring that we get throughput through the system, that we're doing so in a safe and high quality manner, that we're providing access to our patients. And then really the second half of what we're trying to do is transform the way that we're delivering care. So going from this traditional fee-for-service model into a much more risk-based, value-based type of model, where we're treating the patient's outcomes for their outcomes instead of just, on a transactional basis. Think about all sort of the changes that drives in terms of how the technology works, but then also how our operators, how our clinicians provide care. It's a transformational change to the system. And, one that give a lot of credit to our CEO, Chip Davis, Dr. Chip Davis, is really leading the charge on that and trying to plan for the future. When 2030 comes around and CMS starts to pay on value in a much more earnest way, I think we're going to be very ready in Northern New York to take on that challenge.